Hi everyone, Jen here with Nurturing Expressions. I'm here to talk about last week's trivia question, give you the answer, and a little info. So last week's question was, it's very important not to allow baby to nurse on a breast infected with mastitis, and the expressed milk should also be thrown away. The answer to that is false. It's not true at all. You can continue to nurse baby throughout having mastitis. But let's talk a little bit about mastitis. So mastitis is a blocked milk duct or bacteria that's entered the breast. So some signs you might have mastitis are going to be pain in the breast, redness or swelling, warm spots, and a fever or chills. Antibiotics are typically needed to clear mastitis, especially if you have a fever. But some things that we found that can help shorten the duration of mastitis are to continue to nurse baby on the affected side, to take sunflower lecithin as a supplement. It helps thin the milk and shorten the duration of the clog, and use heat and massage. So warm the breast and massage the clog. But know that mastitis is really pretty common. So 1 in 10 women typically have mastitis through their breastfeeding journey. I was one of them. So reach out if you have any more questions. We'd be happy to help you. And this week's trivia question has already been posted. So make sure you weigh in and have another chance to win another $20 in Nurturing Expressions store credit. Thanks everyone. Hope you're having a great day.